Hello and welcome to the channel. My name is Dr. Rahman. I'm from District Endocrinology channel, and today we are going to talk about 7 complications from uncontrolled diabetes. So let's get into it. Uncontrolled diabetes can lead to multiple medical problems, and so the rate of development of complications depend on how long is the duration of the disease, as well as how well is your diabetes controlled. So getting your diabetes controlled right is key. American Diabetes Association recommends your A1C target in most of the patients should be 7%. So it is important to get that right. And what does this test mean? It means that your sugar control over a period of 3 months, and that 7% is the average sugar technically. Alright, so first complication to talk about is cardiovascular disease. So we know that uncontrolled diabetes can have a very negative impact on your heart, and patients can have heart attacks, they can have chest pains, and they can also develop stroke. So controlling diabetes as well as reducing your risk, such as eating heart healthy diet, getting your blood pressure under control, doing exercise, being more active, definitely helps to reduce that risk. Number 2, neuropathy. Diabetes can have a negative impact on the neurons, specifically talking about your foot. So there are a lot of sensory nerves in your feet, and that can be damaged with elevated levels of your blood sugars. And patients can present with tingling, numbness, and weird sensations, and that can also have a negative impact on the sleep, as well as increases your risk of developing amputations and then make you disabled. So getting your diabetes controlled as well as doing diabetic foot care is really important. Number 3, the same thing, erectile dysfunction in male patients can happen because elevated levels of blood sugars can have damage to the nerves in that area, and so getting your diabetes control right, as well as there are some medications that can be used to treat erectile dysfunction in male patients. The next thing I want to talk about is the kidney damage called nephropathy. So kidneys are the filtration organs. So if the sugars are too high in the kidneys, they can damage those filtration parts of your kidneys, and patients can have protein in the urine. That is why your doctor is checking your urine test when you have diabetes, and that can eventually lead to kidney failure, and then patients may need dialysis or transplant. So controlling your diabetes, as well as there are certain medications that can be used nowadays to slow the progression of your diabetic disease damage on your kidneys. So these are the different things that we can do to prevent that from happening. The next thing to talk about is retinopathy, which is the eye damage. High blood sugars are known to damage your eyes. They are also known to cause cataract and glaucoma. So seek your eye doctor at least once a year is great in fixing and finding the problem as it starts. Other thing to talk about is diabetes does increase risk for skin infection because it decreases your immunity. Immunity is the capacity of your body to fight infections. So if your immunity goes low, your chances of having different infections, not just skin but everywhere in your body, increases. So most commonly patients can have skin infection, which can be bacterial or even fungal infection. So keeping a good hygiene and getting your sugars in normal range definitely plays a major role. Last thing to talk about, I see a lot of diabetes patients on daily basis, and I see there is a huge prevalence of depression and anxiety disorders among type 1 and type 2 diabetes patients. So that is also one of the things to keep in mind. Well, this was a quick brief overview of 7 most common complications that we see in our practice with the patients who have diabetes. If you have any questions, comments, please leave a comment, and please subscribe to the channel. Thank you so much for watching, and I'll see you with the next video. Thank you. Ciao.